And welcome to Jexperts. We are live downtown Toronto Bay and Dundas. My favorite part of the day, hosting this show, Jexperts, because we have amazing, interesting, fascinating, fun, effervescent. In this case, my next guest is effervescent. We can get away with that term. I'm here with Dr. Effie Habsha. Am I pronouncing it right?
You are.
All right. Nice to meet you.
Nice to meet
it's so much fun to have you in the studio.
Thank you. It's good to be here.
Yeah, and I want you to know, you're a little bit nervous now. A little bit, tiny bit, little bit, tiny bit, little bit, right?
No.
No? Okay. If you were, I wanted to let you know you're with friends.
Good.
You're with family.
Of
There's no
course.
reason to be nervous. And I wanted to ask you, what is a prosthodontist? Because this is something that some people will need clarification on.
Okay. So that's my specialty.
Yeah.
A prosthodontist is essentially a dentist who does additional training. So beyond dental school, we do an additional 3 years of training in the field or the specialty of prosthodontics. Do you want to know what prosthodontics is?
Now, you know we're Jewish, right?
Right.
So we don't prosthodontalize.
Okay.
We don't proselytize. We don't proselytize. This whole thing is getting so weird so quickly. How do you work with these phrases?
Okay. Well, I think.
No, are you ever? Let me ask you a question. Sorry to interrupt the interview,
Yeah.
but are you ever like in a consultation with somebody and you start to can't quite get your tongue around these words? Or I guess
Not
this
usually.
is old hat for
No,
you.
no. This is.
Prosthodontics, and you're
yes.
a prosthodontist.
That's right.
But you don't proselytize.
That's correct, I guess. Whatever that means.
Very good, very good. My grandmother is very proud of you already.
Thank you.
So let's talk about prosthodontics.
Okay. So it's a specialty, just like there are other specialties in dentistry. Prosthodontics is a specialty of replacement of missing teeth, bone structures, enhancing people's smiles with a variety of cosmetic procedures, if you will. So that's kind of encompasses a sort of work that we do.
Right. And, in this business, they say that you're only as good as your smile.
That's right.
Which I changed it and I said, you're only as good as your dimples.
You got those.
But listen, you got those.
Yeah.
You got those. Okay, listen. How important, and we know a smile is good, but how important is a smile really in life? And when people come in and they say, Effie, what value should I put on this?
Okay.
Well, so let's talk about the value of that.
The value of a good smile, I mean, it's priceless. For me, as a dentist, the first thing I notice when I look at someone is their smile. And I think a lot of people focus on that too.
Yeah.
And
now I'm getting really insecure, Michelle. I often refer to Michelle. She's our executive supervising producer. She's sitting over there.
Okay.
And I look over just for a sense of security.
Okay.
And I'm getting very insecure, Michelle. I thought I had a pretty good smile, but I'm looking at her, and she's like, what, 1,000 megawatt smile. How much did your smile cost?
Mother Nature. No.
Mother Nature.
But there are a lot of things that you can do if you want to enhance your smile.
Right. So, speaking of that, let's talk about the traditional way. Somebody comes into you. What are the traditional ways to enhance a smile? And so let's say, for instance, somebody comes in with a good smile. You say, it's a good smile. You don't want to be too critical, but it's a nice smile. How would you advise them on enhancement?
I think you have to look at what the issue is, so what you're looking to enhance. So a lot of factors make up what makes up a pretty smile. So whether it's the color of your teeth, the shape, the amount of gum tissue you show, are the teeth crowded, all of those things can contribute or take away from a beautiful, perfect smile.
But does it need to be perfect?
No, it doesn't need to be perfect.
Because here's my issue, and by the way, your firm, I don't know, do you use the word firm?
Or practice.
Your practice is known now as the premier practice in the GTA and maybe Southern Ontario. You're great at what you do, so I can be candid with you.
Sure.
Being in the TV industry, my biggest thing is I see a lot of people and they come with these back after procedures with these, they look like a baby grand piano. And they've lost that subtlety, that uniqueness, that you know what I mean?
Sure.
That is them. And don't you agree, nobody ever wants to lose the individuality of their smile.
Absolutely.
So how do you use enhancement and still preserve somebody's uniqueness?
I think it's just customizing, not everyone gets the same treatment. So it's customizing the patient's needs, the patient's wants, and making it their own. And having a facility that allows you to do that by having the technicians right there can allow us to customize one's smile. So the smile of a 20-year-old isn't necessarily going to be the same as a 60-year-old smile.
Right.
And we can build that into what we do very well.
Right. What if you added dimple procedures to your repertoire? You have to talk to Isaac about that.
Oh, we are getting into the face.
It's changing. It's changing. Like every day, the industry seems to advance, doesn't it?
Yeah, it's all part of...
Effie, what's the least, people often come in, they say, well, I don't want anything invasive, right? It's a word you probably hear all the time, right?
Sure, yeah.
So what is the least invasive procedures one can do?
You can start as basic as whitening your teeth. So patients that come in with teeth that are reasonable in shape and not broken down, but they just want an enhancement of the color.
Right.
So we can give it a boost with whitening.
With whitening. Now,
Yes.
What is whitening? What does that mean?
So whitening is basically a procedure where we apply a solution, essentially a hydrogen peroxide type of material on the teeth, and it basically takes your teeth and removes any of the stain, intrinsic and sort of superficial stain, and just enhances them and makes them nice and bright.
Is that like the sandblasting that they traditionally do?
No, it's, the gold standard, if you will, is to have the in-office whitening that the dentist can do for you, and you supplement that with home whitening, which are little trays that you put in your mouth and you put the solution in your tray. So that's what we recommend.
Right. And laser does not allow you to?
That kind of falls under the umbrella. I mean, people say laser whitening. It's sort of the dental whitening that's done in office.
Now, can anybody have this done? I mean, are there people that are excluded from this for some reason?
Yeah, so if you have a lot of bonding, for example, or pre-existing crowns or veneers on your teeth, those don't accept the whitening process. So you've got to be careful. I mean, if you whiten your teeth and you have a lot of bonding, you may need to replace the bonding. So, you have a consultation and we can determine whether or not you're a suitable candidate.
Okay, so what if somebody has, they do not have straight teeth, and they have some issues they have predominant issues with the alignment of their teeth.
Okay.
Does that exclude them from having whitening procedures or other procedures?
No, not necessarily.
Okay.
You can certainly whiten your teeth in any sort of situation, but if you're looking to correct teeth that are crowded or crooked, you can do things as simple as orthodontics or Invisalign. It's not necessarily simple, but you can correct your teeth by moving them orthodontically, or you can choose a prosthetic solution, which is what we do, where you can place porcelain veneers on teeth that could be slightly misshapen or overlapping, and that way you get essentially instant orthodontics. You can align your teeth very quickly in that fashion.
Okay, so people are talking a lot now about porcelain veneers. Okay, so again, maybe you can kind of explain what's up with porcelain and veneers and how the two go together.
Sure. So just to explain what a veneer is, basically, it's essentially a porcelain facing that we place on the teeth, and we typically, adjust the teeth ever so slightly, just removing about 0.5 millimeter or less of the tooth structure, and we can place beautiful porcelain facings on the teeth, and by doing so enhance their color, enhance the shape. If they're slightly crowded, we can correct them so that way you can get instant orthodontics by aligning them with porcelain veneers.
And that obviously makes it easier to color once you have the porcelain veneer.
Yeah.
Now, how does that relate to caps?
So caps or crowns are a little different. A veneer just covers the front of the tooth. It's just a facing, whereas a crown involves filing down or preparing the tooth in its entirety, 360 degrees, and putting a full cap or crown on the tooth.
What is the most common thing when people come into you? Is it caps and crowns, or is it porcelain veneers, or it's kind of a mix of both?
It's a mix of both. I mean, we have so many different things that we do in our office. So, if you're suitable, again, no one gets treated the same way. Everyone is different. So depending on what What the issue is, a person may get a combination of crowns and veneers. So there's no hard and fast rule.
Right. So let me ask you a question. We've talked about, prosthodontics and the value of the intrinsic value of a great smile, which you really can't put a value on, because really some might say a smile is who you are at your best, right? And we've talked about, veneers and crowns and all these great things. I'm wondering what has been the most challenging procedure for you? And has there ever been a day or a patient that comes in, a client that comes into your office, and you just think, wow, this is turning out to be much more complicated than I anticipated?
I mean, difficult clients, if you will, or patients. I think people come in with some, anxiety oftentimes. So the person that you see in consult is that's not really necessarily indicative of the actual person. So we try to kind of make people feel at ease.
And how do you do that?
Just with our sunny personalities, and we have great staff. So from our front desk to my assistants, hopefully the doctors, we try to make people feel at ease.
Right. Now, what kind of drugs do you got going on there?
At the office or right
Pain.
now?
Yeah, I was going to say your pupils look a little bit dilated. I didn't want to get you in any trouble.
Oh, stop.
No, okay, seriously. Laughing gas? But nobody uses that anymore, or do you?
No, we can, but
because it's. I was wondering. People always ask me, when you go to the dentist, what do they give you? What do they give you? Any good stuff?
No,
they make it sound like it's I'm at a street corner at the Bronx.
Yeah.
What do you use for pain management at the office? Do you mind me asking?
No, I don't. I think that's a reasonable question. Really, I think if the patient comes in with a lot of anxiety, just making sure that there aren't time constraints, that we have time, because people want to be heard and not to feel rushed. So, just putting the patient at ease does wonders. For the more involved cases, perhaps surgical cases, we have the ability to put people to sleep completely. So that could, we can knock someone out completely. And then, the majority of the work is done just under local anesthetic. But we do have means to, take the edge off if a patient requires it. Again, everyone's different. So.
But when you say you have means, it sounds so vague.
Well, we
have means. I didn't, is there a little wet bar that
there's
opens
there's
up
a spectrum. So we
Yeah.
can do just kind of oral medication that's just taking some Ativan just before a procedure, to something as deep as having an anesthesiologist come in and put someone completely to sleep for the more extensive surgical procedures.
Okay.
But the majority of the work is done under local.
Just for the record, though, Effie did not require any Ativans for this interview on Jexperts. She was a little bit, I saw her in the green room, she was a little tiny bit trepidatious, but the trooper that she is, she said, I'm not doing nothing. Sober
it's because
is
of you, Eden. Because of you.
I warmed you up. Sober is you felt it doesn't really matter.
Sober.
Sober is a prosthodontist.
There you go.
Okay, so let's talk about like a difficult procedure. What is an involved procedure for you?
A difficult procedure.
Well, a procedure that is lengthy.
There are complicated, lengthy procedures, but those are the
what's
ones.
What's an example of a complication that could arise?
It depends on what you're doing. So, why don't we go with a lengthy procedure? We have patients that come in for full mouth rehabilitation. So we can have.
Now this is now, come on. You can't just say full mouth rehabilitation without explaining what
I'll elaborate.
That means.
If someone has extremely worn down teeth and we need to basically redo their whole mouth, so
they've
maybe
been chewing on a cedar tree for 6 years.
Something like that. Sucking on lemons or something to wear away the enamel, as we were talking about during the break. We can do what's called a full mouth rehab, where we essentially crown every tooth in their mouth. So those procedures can be full day long procedures. We tell the patients to come in comfortable clothes and expect to be there for a long day. So those are long days, but they're fun. So it's not.
They're fun because you love what you do.
Yeah, exactly.
You love what you do. Speaking of loving what you do, let's talk about the emotional component of this.
Sure.
And we were talking in the break, you and I, about that. So there is an emotional component, like life in general, right? There's an emotional component for you in terms of the relationship, right?
Absolutely.
Because these people, I would imagine, become friends sometimes,
Definitely,
right? Yeah. It's part of life. And the emotional component of how these people are totally transformed by the work you do. So let's talk
Yeah.
a little bit about that. First, let's talk about the relationships, and then you
Yeah.
can talk about the excitement of how they really re-engage their life with a new vigor.
Sure.
Right?
I mean, I love what I do, and I
Mm-hmm.
love the patients that I work with. And a big part of that is developing relationships.
Mm-hmm.
I mean, that's why I went into prosthodontics, because a lot of the work, a lot of it is elective. People want to come to me because they want to be here. They
Right,
want
right,
to see me. They
right.
want to enhance their smile.
Right, right.
So they're not coming in pain and are fearful.
Right, right.
So that gives us the opportunity to really foster relationships and really, transform. I mean, it might sound corny, but transform people's lives sometimes.
It doesn't sound corny at
Yeah.
all. It's that I think a smile is that important. In
Yeah.
fact, in the break, you
Yeah.
you received an email. I'm going to ask you to read that for me
Oh.
now. Don't be shy. Don't be
Sure.
shy. This
Actually-
is an example, a tacit, very, very pronounced example of how good they are, what they do. She gets an email in the break. You read it for us, Effie. This is great. This
I
is
mean,
great.
it's kind of coincidental that it came up, but
It's
it's
great,
very
it's great.
heartwarming. It's from a patient who, she's probably in her 50s, and she came in and saw me and said, I've paid for my kids' education. She has, I think, 2 grown boys, and I've spent all the money on their dental work, orthodontics, etc. She said, I'm finally ready to do something for myself. Actually, I had seen her maybe 3 years ago, and then she put off treatment for a while because she had
Right,
other commitments.
right.
She finally came back, and then we did a very simple procedure, some veneers and crowns for her. And this was the email that she sent me, just the majority. She said, I couldn't go without telling you that I'm so grateful to you for my beautiful new smile. I was at the hairstylist this morning, and we were laughing about something, and though I tend to avoid looking at myself in the mirror, I caught a quick glimpse of myself with a big smile. And for the first time in so many years, I wasn't embarrassed to keep smiling. And then she wrote, there are no words for how good that feels. Thank you so much. And then she went on to, thank the
Signed
staff. And
Mom.
yeah. If my mom's name was Christine, no, but that's from our patient Christine, and she's lovely. And we really,
And you get these all the time, and I think
it's heartwarming.
I think that's the rewarding part about what you do.
it's very, very rewarding.
Not unlike the rewarding part about what I do. When you go home and say, "Well, I had the greatest interview today on Eden's little web TV show called
Okay.
Jexperts." Did you have fun? I want to know the
I
truth
have.
now. Cameras have stopped. Cameras have stopped. Nothing's rolling. Right,
I
Michelle?
had.
How much
I'm
fun
having
did you
a
have
blast.
today?
I think this is great.
This is your first time on
This is my
kind of like a
first
TV
time.
show, right?
Well, in this sort of format, yeah.
Okay, so you had fun.
Yeah.
Okay, now, what do you rate me as a host? How do you rate me in
Well, I
terms
only
of
have
content?
one to compare it to.
That's
yourself.
all I'm
So
asking
you're a 10
to.
out of 10.
But hey, this is another great coincidence. Your daughter is named Eden?
My daughter is named Eden.
Your
So there
daughter's
you go. I
named
named my
Eden.
firstborn after you without even knowing it.
Without
so.
even knowing it. What
Yeah.
a great name.
Yeah, it
listen,
is.
Listen, it was such a pleasure to meet you and have you
Likewise.
on the show.
Likewise.
And I think the audience gets a great education on just how important a great smile is. And it really, folks, it really can transform your lives and turn you into a whole new person. So this is great. Thank you so much.
Thank you so much, Eden.
Okay,
Thank
take
you.
care. We'll be right back on Jexperts from downtown Toronto. I'm Eden Wall. Back in a minute. Thanks for being here, folks.
Thank you.
Thanks.